At the heart of Marina, Lagos, General Hospital Odon stands as a beacon of public health care. For years, its wards cared for countless citizens, but two wards in particular, Ward C1 and Ward C2, were in urgent need of renewal. This is the story of how over 150 million naira was raised, mobilized, and invested to transform these critical spaces through vision, community partnership, and Rotary service. By 2023, it was clear that C1 and C2 had deteriorated. Cracked walls, outdated facilities, and cramped spaces limited effective patient care. These wards were central to the hospital's service delivery, and their condition directly affected healing, comfort, and clinical outcomes. The Rotary Club of Ikoyi Metro took up the challenge with a vision to restore dignity and improve healthcare for hundreds of patients daily. The renovation began under the leadership of past President Adekemi Folorunsho during the 2023-2024 Rotary year, and was sustained under immediate past President Bolaon Adeyinka in 2024 to 2025.
So the aluminum windows been installed, making good progress. This one is C1. Okay. That's what C1, yeah. Making good progress. Suspended ceilings. So in progress. The windows installed. Plans in place to press the window. Close the gaps. Yeah, this is looking more like it.
Building on their momentum, the current president, Rotarian Alex Chukwu, accelerated the project with fresh energy and community support.
My name is Rotarian Alexander Chukwu. I'm the United President, Rotary Club of Ikoyi Metro. That's the president for the year 2025-2026. We are at the General Hospital of Odon, which happens to be our STAR project.
From facility audits to hospital staff consultation, the decision centered on addressing overcrowding, outdated infrastructure, and improving safety and comfort for patients and staff alike. The renovation encompassed structural repairs, electrical upgrades, wall and floor refurbishments, new beds, improved sanitation, ventilation upgrades, and better patient flow design. All of this was made possible by funds raised from club members and external partners, reflecting the power of organized civil society to supplement public healthcare provisioning.
This project was conceived, 3 Rotary years ago. In Rotary, this whole thing is kind of continuum for us. It started in the Rotary year 2023-2024 under the leadership of Adekemi Folorunsho, and then continued last year under the leadership of Bolaon Adeyinka, and then this Rotary under my leadership we were able to complete the project, and then we'll be commissioning on 24th are commissioning just only C1, C2. If you look around, if you walk around the hospital, you will see that we also touched F1, F2 upstairs. We changed out the entire window that we have there to a better, aluminum window, and then we painted the whole of the exterior. If you see the picture of what we met, so an abandoned hospital, and then what led to this? Some team came here, and of course they found some people being turned back. Patients rushed in, to put me an emergency ward. Patients rushed into the hospital, and then they don't have space. And what that means is that in the course of conveying them, going for other places to keep them, we might lose them. And that we're thinking of other projects at that time. I was the service project chair there, and then she said, no, let's consider this project. We took it up. Under her year, she was able to rally around and then get the whole approval or require the whole bill. And then the last Rotary year we started. Then she did some work, and then this year last Rotary year, under the dashboard we started some work. If you look around, we cleared the whole debris, did some demolition work. We started off, with the aluminum windows, the piping work, electrical work, the suspended ceiling. And then this year we concluded all this, and then went into the equipping. We're not just doing refurbishment, we're not just cleaning up the whole place, we're also equipping. If you go to the toilet, you see, tidied up the toilet, all the tiling work, the floor cleaned up, and then you look around, you see the beds, you see overbed table, you see digital monitors, you see, I think we have some suction machines, you see oxygen concentrators, trays and all that. These things cost a whole lot of money. The rough estimate, looking at our C1, C2, spent almost about 47 million on equipping alone. On the project, the last number we tracked, about 140 million naira. And these are aside public image, aside administration. And then, like I said, C1, C2 is not the only project we're doing here.
Through periodic reviews, clear procurement guidelines and community reporting sessions, the club ensured accountability and responsible stewardship of donor resources. This level of oversight built confidence among internal and external supporters. Rotary International champions disease prevention and treatment, one of its key areas of focus. By upgrading these words, the club directly contributes to reducing preventable complications, supporting better infection control, and creating an environment where healing thrives.
We have about 3 projects we are commissioning on the same day, and this project touched altogether about 3 areas of focus of Rotary. First is disease prevention and treatment, because we are talking of emergency wards here. We also have maternal and child health, and then of course we have water, sanitation and hygiene. We have a water project behind where we have installed a stanchion, water stand. We have 4 water tanks, and then an aeration tank, a 5,000 liter tank, the water filtration or treatment facility, and then the pump. So all this Rotary Club of Ikoyi is doing to touch lives in positive ways.
The plan includes partnership with hospital leadership for routine maintenance, training for ward staff, and integration of community volunteers for periodic upkeep, ensuring that the investment endures beyond today's celebration.
Of course, we are collaborating with the hospital management, because in Rotary you can't do this kind of a thing and just abandon it. We've engaged the management of the hospital and then the head admin of the HR that we need to set up a community call, people that will put an eye on this thing. Ikoyi intends to adopt these 2 words, So from time to time, you see our presidents coming in here to make sure that whatever it is that we need to maintain, we need to fix, make sure that kept in good shape to ensure sustainability of this project. In terms of impact, this is a 44-bed, 41 for patients. You have about 35 2 cranks bed and about 6 3 crank beds for the private private wards. So 41 for patient, and then we have a nursing bay, where you also have some beds we're going to put in there, for the nurses. So the 44 capacity ward, and then of course imagine a hospital that's a limited facility. Now suddenly is able to keep about 41 people all at the same time. That would actually, you can't quantify that on day-to-day basis in terms of impact on people that will have probably been rejected, and then maybe in the course of conveying them or looking for that hospital, we lose them. Now we're able to save more lives by putting this facility in place.
Collaboration extended to local government health officials and hospitals administrators, reinforcing that improvement in public health infrastructure requires joint efforts across sectors. Ward C1 and Ward C2 are now more than rooms. They are spaces where recovery is possible, where hope is renewed, and where community spirit meets healthcare delivery. This project stands as a testament to what collaboration, dedication, and service can achieve.